So good day class, we will be discussing about your carbohydrates. So your carbohydrates is the primary source of your energy. Primary source for brain, erythrocyte, and other cells in the human body. Okay? Major food source and energy supply for the body, as said. No? Major. Major source. Okay? Now we utilize as glucose. Your glucose is under your carbohydrates, thus no, converting it to ATP to generate energy in our body. Okay, this is primarily stored no, in the liver and muscles as your glycogen. Okay, the storage form of your glucose or your carbohydrates in the human body is glycogen. What about on your plants? No, your plants store their glucose or your carbohydrates in the form of starch. Okay, then building blocks for many processes of metabolism. Bakit? Kasi your carbohydrates nga generates ATP. Okay? Your ATP is primarily used as the source of your energy in the metabolism. Okay? And this is known to be your central ingredient for life because without carbohydrates, you cannot metabolize anything and you cannot produce energy. Okay? Okay, general description of your carbohydrate. No? This contains carbon, hydrogen, and oxygen. So the main, it is known to be your chalk or your carbohydrates. Okay, general formula for this is your carbon, no, then number of carbons, hydrogen, 2, and oxygen, number of that two elements. Okay, so for example, is your sugar, your C6H12O6. Okay, H12, sorry. That is your table sugar. Okay, then it contains carbon, double bonded to oxygen, and or no alcohol functional group. Okay, it's either it contains either alcohol or even in your carbon double bonded to oxygen functional group. And derivatives of this, no, it can be either binded to phosphates, sulfates, and amines. Okay, like your um, glucose phosphate, okay, or glucosulfates. Huh? They are bounded together to form another compound or derivative. So your carbohydrates is classified in four different properties. First is your size. Okay, size of the base of the carbon chain. So this is based on your carbon chain. So later on, kung gaano kahaba yung chain, dun natin siya i-classify. Okay? Then location of your functional group. Location of your functional group and number of sugar units. Then the stereochemistry of the compound. Okay? What are those stereoisomers of the compound that can be produced with regards to your no, carbohydrates? Okay, so let's first do the based on the number of carbons of molecules. Okay, then the generic classification are 3 carbon compounds is your triose, 4 carbon compounds is your tetrose, okay, 5 carbons is your pentose, and your 6 is hexose. Okay, note that your pentose and hexose are the most important carbohydrates in your body. Why? Because your DNA and RNA are composed of your pentose and hexose. Okay, deoxyribonucleic acid and your ribonucleic acid, okay, are composed of your pentose and hexose. Thus, they are the most important carbohydrates in your body. Okay, next is based on the location of your functional group. Okay, hydrates of aldehyde or keto. It's either aldose. No, the functional group attached to your carbohydrates is aldehyde. And ketose, the functional group attached to your carbohydrates is keto. Okay? Then anomeric carbon in the functional group. I just want you to know that these aldose and ketos, no, can be, no, noted to be more important, especially in diabetes. Okay? The production of ketones in your body. So this is the tree, no, showing that your glyceraldehyde, no, D-glyceraldehyde, okay, can be furthermore, no, attached to other components, no, and produce other carbohydrate like your erythrose, no, which is primary seen in your RBC. Erythrose, then it has an stereoisomer of your D-treose. Okay? Then if you add another, no, water or H2O, no, it will have ribose. Then a stereoisomer of arabinide ribose. Okay? Pag sinabi mong stereoisomer, isa lang yung na ibang part. Like in your erythrose, ito lang. And then ito lang. Okay? For your ribose, ito lang. Okay? And so on and so forth. Hanggang mag-add lang na mag-add. And then, meron yun, corresponding stereoisomer. Okay. Models to represent your carbohydrates. So there are models, no, to represent your carbohydrates. First is your Fisher's projection. Okay, your Fisher projection, no, has the aldehyde or ketone at the top of the drawing. Okay? It has the aldehyde or ketone at the top of your drawing. Then, the carbons are numbered starting at the aldehyde or ketone. It's either straight chain or cyclic in form. Okay? So, ano ang priority ni Fishers? Ang priority ni Fishers is your functional group attached to the carbohydrate. Okay? Yun ang priority ni Fishers. Okay. Ano ba itsura niyan? So, ito yan. Okay? So, asan dyan ang functional group mo? This is your functional group. This is your functional group. Here, this is your functional group. And this is your functional group. Paano daw nasabing nasa taas? Okay, all, no, especially this wedge, now projects that the functional group is in front. Okay, this dotted, no, is this broken line, now projects that those chain are at the back. Okay, so yeah. Next is you have the Howard projection. It is in cyclic form. Your Fishers is either in straight or cyclic, but your Howard is always in cyclic form. Okay? More representative of your actual structure. This is the more accurate one than your Fishers. Okay? Form when the functional group ketone or aldehyde reacts with alcohol group on the same sugar to form a ring. Okay, anong priority niya naman dito? The ring. The hemiacetal ring. Okay? So it looks like this, no? Since it is cyclic, no, you can see that the sugar forms a shape. Okay, the sugar forms a shape. So ano to? This is 1, 2, 3, 4, 5, 6. Okay, this is hexose, no? The glucopyranose. Okay, and then it has a stereoisomer of beta, the glucopyranose. Okay, ano lang pinakaiba nila? Yung positioning ng alcohol group. Okay, classification of carbohydrates. Again, we do have, ano na na-discuss natin? The number of chains. Okay. Next, we do have the based on stereoisomer of the compound. So, there are the various spatial arrangement of carbohydrates. Now, of carbohydrate molecule either have the same order and types of bonds but different in spatial arrangement and different properties. Okay? For each asymmetric carbon, there are two possible isomers. No? This isomers is your mirror image. Okay? So, asymmetric. Either may nabago lang na isang carbon, position ng carbon or functional group or your hydrogen, yun na yung stereoisomer. Okay? So, anong example niyan? So, like this one, you do have the D-fructose. Okay, ang sabi dito, ito lang yung na ibang arrangement, this part. Okay? Kung inikot mo yan, okay, napunta si OH dito sa kabila, at si H napunta dito, you will have the tagatose. Okay? You will have the tagatose. No? Iba na yung composition niya. But still, same ng number ng carbon, same ng number ng functional group, same ng number ng hydrogen attached. Okay? But the arrangement is different. No? Mirror image lang siya. Okay? That's your stereoisomer. Next is the based on the number of sugar units in the chain. No? Relies on the formation of glycoside bond that bridge of oxygen atoms. Ano ba itong mga to? These are your monosaccharide, disaccharide, polysaccharide, and oligosaccharide. Okay, for your monosaccharide, there are the simple sugars. Okay, that cannot be hydrolyzed in the simplest form. Bakit cannot be? Kasi they are the simplest form. Okay, simplest form na sila eh. Paano mo pa sila isi-simplify? Okay, so since they are the simplest, now they cannot be hydrolyzed anymore. Now they are small molecules, no, but they are vital, no, especially in metabolism of inside the human body. Okay? Most important are your pentose and hexose. Okay, sinabi na natin yan. Bakit important ang pentose and hexose? Okay? So, example of your monosaccharide is your glucose. Unang-una, glucose. Central pivotal point of carbohydrate metabolism. Bakit? No? Mainly, this is consumed by our body. Okay? Ito yung always available and we degrade your carbohydrates into simpler form as to your glucose. Okay? We degrade those your disaccharide, polysaccharide, oligosaccharide into simpler form that will have a glucose in it. Okay? Used to assess total carbohydrate used by the body when we measure this on your blood glucose level. Okay? So usually this is only measured, no, when it comes to your carbohydrates inside the body. Okay? So ito yung primary na ginagamit natin in the laboratory in determining your carbohydrate content of the blood. Okay? Another monosaccharide is your fructose. No? This is formed from the glucose and from the breakdown of sucrose. Okay? So your fructose, no? is made up of your degraded form of your glucose and sucrose. Okay. Intermediate inutilization of the monosaccharide. Usually kasi, your fructose is available ano, in fruits. Okay, kaya nga fructose. Fruit sugar. Okay, this is your fruit sugar. Another monosaccharide is your galactose. Now, must be converted to glucose before it can be utilized in your body. Okay, as I said kanina, most pivotal si glucose. Bakit? Even this monosaccharide na yan, it still need to be converted to glucose to be used up by your body. Okay? Less significant from the metabolic point of view. And na it can cause also galactosemia. Now, galactosemia is a defect no, in an enzyme that degrades your galactose to form glucose. Okay, that's why if ever that a patient no, consume galactose containing products such as your milk, no, because your lactose can be degraded into galactose. Okay, the patient will experience some no, um, difficulty no, in degrading the galactose. Thus, your body will excrete it immediately na hindi siya nade-degrade. So, walang kwenta kahit kumain or minom siya ng galactose. No, kasi wala naman siyang enzyme to convert those to your glucose. Okay, galactosemia. Next, you do have your disaccharides. So, your disaccharides no, are no, two monosaccharide combined. Two monosaccharide combined. Importance is your nutrients they provide. Okay? The nutrients that being provided by your disaccharide is important to your body. Bakit? Still, when you consume your disaccharide, it will be no, metabolized into simpler form such as to your glucose, okay, to be more no, utilized by your body. Okay? Biochemical marker for a certain disorder of your carbohydrate metabolism. We can also test these disaccharides no, to provide us information in your carbohydrate metabolism. Okay, bakit? Kasi nga, it is metabolized by your body. Okay, if ever that you do have increased disaccharide in your blood, it will no, signify that the body cannot degrade those no, complex form of sugar into simpler form, thus giving you metabolic disorders. Okay? Form in interaction of between two monosaccharides, sinabi ko na, two monosaccharides, with the production of molecule of water. So, no, this disaccharide is being dehydrated or hydrolyzed. Okay? Kasi when you degrade them, you are forming water molecule or your H2O. Okay. So first in your line is your sucrose. Your sucrose is formed by glucose plus fructose. Okay, these are two monosaccharide. Okay? This is commonly known as your table sugar. Okay? Sucrose. Kaya hindi mo pwedeng sabihin glucose yung asukal mo. Kasi meron siyang kasamang fructose. That's why it is known to be your sucrose. Best known of the disaccharide because this is commercially no, available. Best known. Okay? This can be obtained from your fruits, vegetables, no, and plants. That's just your beets and sugarcane. No? Primarily, we utilize a sugarcane in production of your sucrose. Then, provides major portion of carbohydrate intake for many individuals. Okay? Next is your lactose. This is a combination of your glucose and galactose. That's why if you consume no lactose containing product, if and you do have galactosemia, okay, you cannot degrade that lactose. Okay, you will produce a disease, or you will manifest an illness such as your lactose intolerance. Okay, you cannot degrade lactose because you don't have any enzyme that they degrading your galactose. Okay, this is known to be your milk sugar. Tandaan, milk sugar. Because they are found in dairy products such as your milk and cheese. Okay, next is your maltose. Maltose is glucose plus glucose. Good source of glucose because two glucose molecule are found in this. Okay? You can find this in your cereal with malt products. Okay? Next is your polysaccharide. Your polysaccharide is formed by linkage of many monosaccharide unit. Many. But that many can only be less than 10. Okay? Less than 10 monosaccharide ang polysaccharide. Kasi more than 10, we will also have different category for that. Okay. This can be degraded by your hydrolysis to form simpler form of carbohydrates. Okay. And what are your polysaccharide? So first, you do have the starch, no, which is a glucose molecules, primary carbohydrate in the diet found in most plants. So sabi ko kanina, your storage for your glucose in plants is in your starch. Okay? This is found mostly in your plants. No? Glycogen is the storage form of your carbohydrates in human. Okay, in human. No? This is formed from glucose by the liver. Bakit? Your glycogen is formed due to an excess glucose. So if ever there's an excess glucose in your body, your liver will convert that into glycogen. Then it is stored in your body. Okay? To further utilize if ever you will have a decline in carbohydrate intake. Okay. Next is your cellulose. Okay? Another polysaccharide found in the plant. Okay? Not digested by human. You cannot degrade your cellulose, for we don't have any enzyme that is responsible for the degradation of your cellulose. Okay? It does not provide any proper intestinal function. So, pag kumain ka ng may plants na may contain ng cellulose, walang wenta. You will just excrete this polysaccharide. Unlike your starch, you can metabolize it due to its glucose molecule. Okay? Next, you do have your oligosaccharide. Chaining of 2 to 10 sugar units. Okay? This is polysaccharide by plus polysaccharide. So yeah, chain of 2 to 10 sugar units. Okay. Okay, next you do have your dietary intake. So your dietary intake of your carbohydrates, there are only two types of carbohydrates which should contributes to your human nutrition. Okay, which contribute to your human nutrition. And what are those? These are your starch and disaccharide. Okay? Starch and disaccharide. Bakit? You cannot intake, pure monosaccharide. This is polysaccharide. Then this is your dye. Okay? Representation of your dye. Ano yung mga dye natin? Such as your sucrose, Okay, lactose and maltose. Okay, those are your disaccharide. Your polysaccharide, you only consume starch. Bakit? Another polysaccharide you have is glycogen, which is produced by your body in excess carbohydrates. Your cellulose, you cannot degrade cellulose. That's why it's not, does not contribute to human nutrition. Okay. So in glucose metabolism, you do have several, several metabolic pathway. Ano yung mga yan? You do have glycolysis, gluconeogenesis, glycogenesis, and glycogenolysis. Okay, your glycolysis, this is the degradation of your carbohydrates. Glycolysis. You are lysing the glyco content, no, or glucose content of your carbohydrate. Next is you do have gluconeogenesis from gluco, no? Gluco means sugar, neo means production, okay? Genesis is new, no? You do no, provide or make you make glucose out of non-carbohydrate analytes. Okay? Such as your fats, okay? Non and carbohydrate containing, no? Such as your disaccharides, polysaccharides. Okay, you make sugar out of those. You make glucose out of those. Fats, protein, okay? Then you do have glycogenesis, which means you are making glycogen, production of glycogen, production of glycogen. So, in what? In excess. Excess carbohydrates found in your body. And your glycogenolysis, okay, you make glucose out of no out of your glycogen. Okay, you are degrading your glycogen to make glucose. So that those are your glucose metabolism found in your body. So these are the pathways. Hindi naman ako masyadong particular in these pathways. Okay, this is your glycolysis. From glucose, you are degrading the glucose to produce what? To produce ATP and no, pyruvate. Feeling ko lang to. Okay? You produce glucose. You degrade glucose to produce energy. Okay, you degrade glucose to produce energy. That's your glycolysis. This is your glycolysis. Okay, next is you do have your, ayan, pala, ito yung mas kompleto. Yung glycolysis is your red part, and then gluconeogenesis is your blue part. So you make, out of your glucose, you make your pyruvate and ATP in glycolysis. No? So your glycolysis produces ATP and pyruvate. Then your pyruvate will be utilized again to make other content. Then your gluconeogenesis provides you glucose. Why? You degrade other non-carbohydrate or carbohydrate containing, okay, metabolites in your body to form glucose. Okay, glycogenolysis. Okay, this is from glycogenesis, no? You make, no, glycogen in excess carbohydrate or in excess glucose. Okay? Anong product dito? Glycogen. Next is you do have glycogenolysis. No? You synthesize glycogen in excess glucose. Or, no, glycogenolysis, you do use no other metabolic component to produce glucose from your glycogen. We do have hormones na related with your glucose, such as your insulin, which is the primary hormone responsible for the entry of glucose into the cell. Entry of glucose into the cell. Okay, pinapapasok niya yung glucose inside the cell, no, to be utilized as to your energy production, no? It is formed from your beta cells of your islets of Langerhans of your pancreas. Okay? So if ever that the body or the cells detect an increased body glucose, how? If you intake food, okay, you increase your glucose. Then your body releases also insulin to decrease that glucose and to utilize that glucose by your cell. Okay? Kaya yung diabetes, no? We do have insulin dependent and non-insulin dependent. Okay, discuss natin yan later. Okay, your insulin is increased in glycogenesis and glycolysis. Okay? Then glucose glycogen pyruvate acetyl CoA. It also increases lipogenesis. Sinabi mong lipogenesis, you are forming, no, fats or lipids out of carbohydrate excess. And it also decreases, no, glycogenolysis, because your glycogenolysis is production of carbohydrates from glycogen. Mataas na kasi yung sugar, mataas na yung glucose content mo or your carbohydrates in the blood. Thus, no, pinipigilan niya na yung pagtaas palalo due to your glycogenolysis. So that's your insulin, no? So this is your pancreas. Okay? That mainly produces your hormones responsible in maintaining the balance of your carbohydrates in the body, especially your glucose. Okay, other hormones, you do have glucagon. Okay, responsible for increasing, no, ito naman, increasing glucose level. Okay, it is synthesized by the alpha cells of your Langerhans in the pancreas also. Okay. Ito naman, pagka na-detect niya mababa na, you do have decrease in bodily glucose, they are being released. Okay? They are being released to release glycogen. No? So, it increases the glycogenolysis, no? Para tumaas yung glucose mo in the blood. Okay? Okay, degradation of glycogen to glucose, no? Glycogenolysis. Increase gluconeogenesis. Okay? It increases the production of glucose through degradation of non-carbohydrate or carbohydrate-containing products, such as your fats. No, tinutulungan niyo yung katawan to degrade fats to produce carbohydrates. Okay. Fatty acid acetyl-CoA ketone can also be, no, regulated by your glucagon and your proteins and amino acids. Bakit? These two can form carbohydrates through gluconeogenesis. So in the decrease of glucose in your body, you will have a condition such as your hypoglycemia. Hypo means low, glycemia means sugar. Okay? So decrease, no, glucose below the normal range. Okay? Below the normal range. Ano ba to? Ano pa to? You do have the Whipple triad. No? Low blood glucose concentration with typical symptoms of elevated, no, glucose administration. So kahit nagbibigay ka ng glucose, no, your body cannot synthesize it, thus producing hypoglycemia. That's your Whipple triad. Okay, symptoms of your hypoglycemia, you do have neurogenic and neuroglycopenic. Ano yung neurogenic? So, your neurogenic, okay, you will observe tremors, palpitation, anxiety, and diaparesis. Those are your neurogenic. While your neuroglycopenic, dizziness, okay, tingling, blurred vision, confusion, and behavioral changes. So your neurogenic is more of the motor function, while your neuroglycopenic is more of your, no, peripheral nervous system (PNS), which produces, no, dizziness, nahihilo ka pag nagkukulang ka ng glucose. Bakit? Because of your PNS. Okay? Okay, you do have classification of that. You do have drug administration like your insulin, alcohol, salicylates, sulfonamides, and pentamidine, no? Which decreases your glucose. All of this decreases your glucose in your body. Okay? You do have critical illnesses such as your hepatic failure, sepsis, renal failure, cardiac failure, and malnutrition. No? Let's include also here neurologic syndrome, because decreased glucose can provide you neurogenic and neutropenic, no, symptoms. Kasi kailangan ng brain mo ng sugar to function. Okay? Then yung hormonal deficiency, like your epinephrine, glucagon, cortisol, and growth hormone, which increases your glucose. So kung kulang ka nito mga to, you will manifest decrease in glucose. Bakit? These hormones increases your glucose. Then you do have endogenous hyperinsulinism, na the pancreatic beta cells has this disorder. Okay? So nasisira yung beta cells mo, thus, okay, nagpo-produce siya ng increase insulin. No? Nag-i-increase ng insulin. Okay? So, ano pag nag-i-increase yung insulin mo, bumababa yung glucose in the blood. Bakit? Your insulin is responsible for the utilization of your sugar. Other classification, no, autoimmune hypoglycemia due to insulin abnormality. Non-beta cell tumor such as your leukemia, hepatoma, pheochromocytoma, lymphoma. Okay, mga cancers can also, no, produce hypoglycemia. Okay, hypoglycemia in infancy and childhood due to galactosemia, GSD, and Ray's syndrome. So these diseases has a, no, malfunction or non-production of hormones or enzymes that degrades your glucose or your other carbohydrates in the body to form glucose. Alimentary reactive, no? Post-gastric surgery. So after your surgery, no, in gastric um, area, you will sometimes no, experience alimentary reactive, so you don't degrade carbohydrates or you don't absorb carbohydrates in your GIT. Okay, idiopathic, when you say idiopathic, unknown cause, no? Postprandial hypoglycemia, when you say postprandial, after you eat, pero mababa pa rin yung glucose mo. Okay? So here you do have disorders such as your diabetes mellitus. So your diabetes mellitus is a group of diseases, ha, hindi lang yan isa, in which blood glucose level are elevated due to deficiency in insulin secretion or abnormal insulin action. Okay? You do have glucosuria, occurs when the plasma glucose level exceeds 180 milligram per deciliter. So if ever your patient, no, has a sugar level more than 180, for example, you do have patient of 200 milligram per deciliter of glucose, it will manifest to its urinalysis, okay, urine glucose. Okay? You will have a positive result with the urine glucose. Bakit? Hanggang mapifilter lang ng kidney mo, okay, is 180. All excess in that will try to be excreted in your urine. Okay, lahat ng excess tinatry i-excrete through your urine. That's why you will have glucosuria or presence of glucose in the urine. Okay, ketosis, no? Excessive synthesis of acetyl-CoA, obtaining energy from stored fats. So if you are, no, metabolically active, no, degrading your fats, which produces ketones, okay, you will have ketosis. Okay, you are degrading too much fats, no, in your diet. You are eating fats, you don't consume carbohydrates. So your body will shift to your gluconeogenesis. So your gluconeogenesis, no, degrades those fats you are eating. Ito yung mga keto diet, no, degrades those fats that you are eating, then you are producing carbohydrates from it. Okay? Okay daw kasi nga magpapayat, no? Okay kasi natutunaw yung fats, but the downfall for this are you are prone into ketone production and ketosis. Okay? Frequent finding in patients with severe and uncontrolled diabetes. Ratio of beta-hydroxybutyric acid to acetoacetate is 6 to 1. But this can also be reversed, no, with your insulin administration. Okay? Kasi it will be utilized by your body or either it's treated. So we do have complications of your diabetes mellitus. You do have end stage, no? End stage renal disease. Bakit? You will manifest first, of course, no? Renal malfunction. Kasi nga, you are excreting too much sugar in your urine. Okay, your sugar is a large molecule. Okay, when it passes through your kidneys, okay, those filtration system will be damaged. Kasi malaki masyado si sugar, nagagasgas. Thus, this diabetes, no, can result to end-stage renal disease. Kaya mapapansin nyo yan sa mga dialysis patient. Usually, they are diabetic. Okay? They have diabetes before going to end-stage renal disease or your no, CKD, chronic kidney failure, chronic kidney disease. Okay, papansin niyo yan. Okay, non-traumatic amputation, if ever your glucose accumulates to your capillaries or small vessels, okay, decreasing the blood flow, you will have gangrene. Okay, pagka nagka-gangrene na yan, namubulok na yan, nagne-necrosis na yan due to decreased blood flow into that area, okay, you will have an amputation. Kaya usually, pagka sinasabi ng iba, ay, kailangan na natin, sir, putulin yung paa. Bakit? They are noticing that there is a accumulation of sugar or glucose in that area. No? The blood vessels are not more viable. That's why this needs to be amputated bago pa siya mag-cause ng necrosis and further diseases into your body. Okay? Also, blindness in adults, no? Usually, age from 20 and older can manifest into your diabetes. Bakit? No, nasisira nga yung mga blood vessels and nerves. Okay, due to accumulation of your sugar. Okay, diabetic neuropathy, no, 60 to 70% of diabetic patient. Diabetic neuropathy, ito yung nagkakaroon ng neurologic symptoms or neurologic malabnormalities in patient. Nagiging makalilimutin, okay? Nagiging hyperactive bigla, okay? Nag-iiba yung behavior, no? Most of the time, no? 60 to 70%. Then, atherosclerotic disease, this also contributes to the accumulation. Kaya nga tayo nagkakaroon ng amputation, di ba? Okay? Your sugar is being accumulated into those small blood vessels. Thus, no, it contributes to atherosclerosis. Ano ba yung atherosclerosis nyo? This is, no, atherosclerosis is your accumulation of fats in your vessels, especially in your aorta. Okay? If this fats, no, accumulates, then you will have a decrease, no, size in the lumen for a while. So your atherosclerosis can contribute to, no, heart and cardiovascular diseases. Kaya there are 2 to 4 predisposition, no, times. Mas mataas yung chances mo to have a heart and cardiovascular disease if you do have diabetes because of atherosclerosis. Okay? Kasi can accumulate into the lumen of your aorta or blood vessels. Kunyari, ito yung blood vessel mo na normal. Your atherosclerosis can form plaques. Okay, mababarahan yan. Magkakaroon ng accumulation ng fats. And diabetes can contribute to that. No? Oh, so, liliit yung diluyan ng dugo. So, possible magkaroon ka ng heart attack. Bakit? Due to decreased oxygen, no, found in your heart. Okay. So, those are complications of your diabetes. Okay, this is an ulcerative, no, diabetic foot ulcer. Okay. Kaya yung mga ganito, no, nagkakaroon ng ina-amputate. Okay? Ina-amputate. So, kunyari ito, ulcer yan. Ulcer that is carved, no? Kinarve yan, of course. Okay, kinarve. Okay? Then, no? Yan, pagaling na siya. Bakit? Nagkakaroon na ulit ng blood supply. Okay? Under syndromes, ayan, no? Nagkakaroon ng nerve degeneration, nagkakaroon ng pain on your hands, no? Then this is the atherosclerosis on the right. No, nagkakaroon ng deposit, yeah, fat deposits. No? Ito yung lumen mo na normal, maganda yung blood flow. Then magkakaroon ka ng fat deposits, no? Liliit yung daluyan ng dugo. Okay? So you do have types of diabetes. You do have type 1 or insulin-dependent diabetes mellitus. Insulin-dependent. Okay? Pag sinabing insulin-dependent, pwedeng, no, ma-administeran ng insulin. Okay? Pag nag-administer ka ng insulin, no, you can normalize the blood glucose. This is juvenile onset. When you say juvenile onset, more commonly on children, no, teenagers. Okay? Doon pa lang nagsisimula na yung diabetes. Also known as brittle diabetes and ketosis-prone diabetes. Okay? So for your type 1, diabetic individuals have insulinopenia. Insulinopenia. Decrease in your insulin. Insulinopenia. No? Mababa yung insulin production ng katawan. Okay? 80 to 90% reduction of your beta cells, no, required to induce symptomatic type of diabetes mellitus type 1. Okay? So if ever that your beta cells cannot produce anymore no insulin, it will only manifest on 80 to 90%. Okay, tsaka lang magkakaroon ng symptoms. Pero if your body are still compensating for it, okay, you will not have symptoms kahit diabetic ka na. Okay, genetic association between your no diabetes mellitus type 1 and HLA-DR3 and DR4 of your MHC. No? So you will encounter this LHA-DR3 and DR4 in your serology and immunology. So this these two genes daw is related to the production of diabetes mellitus. And these two, your DR3 and DR4 HLA, is found on chromosome number 6. Major histocompatibility complex. That's your MHC, which is responsible for your no, immune response. Major histocompatibility complex. Compatibility complex. Okay? Yan, yung HLA, DR3, and DR4 na ng yung MHC ay related daw sa diabetes type 1. So if ever that you will have a genetic abnormality with regards to this two gene, no, you can have diabetes mellitus type 1. Okay, yung diabetes mellitus type 1 yun is related to your beta cells destruction. Bakit beta cells? So your beta cells is related to your insulin. Kaya beta cells, kaya nga insulin dependent siya eh. Okay? Absolute insulin deficiency. Okay, autoantibodies to ano? To your insulin. So your insulin is being destroyed by your body. Okay, dinedegrade niya yung insulin. Hindi nagagamit si insulin kasi may autoantibodies ka to your insulin or your beta cells. Sorry, beta cells of your pancreas. Okay? Islet cells autoantibody. Yan. Ito yan. Beta cells autoantibody. No? Sinisira niya naman yung beta cells of your pancreas. No? Kaya hindi ka nagpo-produce ng insulin. Okay? Insulin autoantibody. Okay, glutamic acid decarboxylase autoantibody because your glutamic acid decarboxylase is also contributing to the degradation of your glucose together with your insulin. Tyrosine phosphate 1A2 and 1A2B autoantibodies. Okay. Ayan. Type 1. Anong sign and symptoms ng diabetes? You will always note this 3P. 3P, polyuria, polydipsia, and polyphagia. Your increase in urine output, your excessive thirst, and excessive hunger. Okay. If you will notice these three, they are the hallmark, or possibly, no, you can point out that this patient has a diabetes. Mga hallmark ng diabetes, type 1. Then, mabilis pumayat. Baka akala nyo yung kapitbahay nyo nag-a-addict. Hindi pala, may diabetes pala, kaya ganun kapayat bigla. Okay. Then, they are prone to hyperventilation. Mental confusion. Bakit? Mental confusion because of the decrease in insulin and increase blood glucose, which no affects the brain. No, possible loss of consciousness due to glucose overload in your brain. Okay, you do have also idiopathic type. When you say idiopathic type, idiopathic, unknown cause. So, no known etiology, walang nakakaalam kung paano nagsimula. Okay? Can be strongly inherited. So, pwedeng mamana. Okay? Does not have any beta cells autoantibody. And required episodic insulin replacement. Okay? So, yan. Next, you do have microalbuminemia. Or microalbumin. Ano ba yung microalbumin? Okay? Okay, ano ba itong microalbumin? No? Your microalbumin can indicate early disorder in your kidney or glomerular degradation. Bakit? No microalbumin should be present in your urine. Okay, your microalbumin is a form of protein. Okay. Your microalbumin is form of protein. So, ang protein mo malalaking molecules. Okay? That should not be excreted through urine. Okay? Bakit? Kasi maliliit yung pore ng yung glomerulus. If ever that is there is a presence of protein, or especially your microalbumin, this denotes that you do have possible degradation of your kidney, and relation to that is diabetes. Okay? Diabetes. So, microalbumin of 50 to 200 milligrams per 24 hours can consider diabetic nephropathy or diabetic related kidney disorder. And your albumin excretion or your protein excretion is greater than 30 milligrams per grams, and your CREA is less than 300. Okay? So, next we do have your type 2 diabetes. Your type 2 diabetes is known to be your non-insulin dependent. Non-insulin dependent diabetic mellitus. Okay? Adult type or maturity on onset. Mostly common sa adult or mature individuals. They are also known to be your stable diabetic mellitus, ketosis resistant. Thus, you cannot see ketones in your type 2 diabetes. And then, receptor deficient diabetic mellitus. Ano may problema dito? Receptor. Okay? So, sa type 2, this is known to be your geneticist nightmare. Bakit kaya geneticist nightmare? Kasi it cannot be predicted. Wala siyang relation sa kahit anong gene. Okay, unlike your type 1, related siya sa HLA mo, DR3 and DR4 of your MHC in your chromosome 6. Pero tong type 2, walang ganon. Okay? has a milder symptoms but may lead to hyperosmolar coma. Okay, your patient can be in coma if ever, no, that there is increased overproduction of your glucose. More than 500 milligrams per deciliter can cause coma. Okay, severe dehydration can also be seen in your diabetes type 2. Bakit? Sugar mo ay matakaw sa tubig. Okay, it will have your water, no? And you will manifest severe dehydration. Electrolyte imbalance. Okay, bakit? Due to severe dehydration. And increased BUN and CREA, which are your, no, kidney function markers. These are your kidney function markers. So if ever that this two is increased, possibly you do have problem on your kidneys, which is manifested by your, no, diabetes mellitus type 2. So your type 2 is also insulin resistant. Insulin resistant with insulin secretory defect. So either your body cannot use your insulin. Okay? Or yung insulin mo nagpo-produce ka nga pero defective. Hindi pwedeng gamitin. Bakit? Baka kulang yung um, component ng insulin or wala lang talagang function. Sira yung insulin na pinoproduce mo. Okay? Can be also relative to insulin deficiency. Okay. So let's distinguish your type 1 and type 2. Ano ba yung paano ba natin distinguish? So your type 1, no, can be related to your beta cells destruction. Okay? Type 2 naman, insulin resistance. Hindi mo ginagamit yung insulin kahit meron ka. Okay, incidence rate, no, mas mababa yung type 1 because this is nga juvenile onset, bata, okay, related sa genetic. Okay? Unlike your type 2, no, mas mataas yung incidence niya because of age. So, onset ng type 1 is childhood or teens. Type 2, any over 40 years old. Risk factor, genetic, autoimmune. When you say genetic, related sa HLA, DR3, and 4 of your MHC on your chromosome 6. Okay? While genetic, sa type 2, bakit genetic? Namamana due to, no, bloodline. Hindi due to this chromosome. Obesity can also, no, a risk factor, and lifestyle. Mga sedentary lifestyle. No movement. Higa lang, upo lang, kain lang. Okay? C-peptide level is decreased and undetectable with your type 1. And type 2 is detectable. Pre-diabetes, no? Autoantibodies is present in your type 1 diabetes. Auto on your type 2 is not present or negative. Symptomatology, mas mabilis makita ang symptoms sa type 1, abrupt ang production ng symptoms. While your type 2, matagal because of asymptomatic stage. Ketosis, common in type 1 and poorly controlled. Mahirap kontrolin ng ketosis sa type 1. Sa type 2, bibihira ka makakita ng ketosis or ketone production. Medication, no? On type 1, since it is insulin dependent, you can administer insulin. On type 2 naman, you will give oral agents. Ano yung mga oral agents na yun? Like your metformin, which helps your insulin to be, okay, to be more functional. Okay, mga glucose decreasing agent natin. Okay? So, you do have also other types of your diabetes, which is associated with secondary condition, genetic defects of your beta cells function, pancreatic disease, drug or chemical induced, insulin receptor abnormalities, and other genetic syndromes. Okay. So, pancreatic disorder, no? Bakit? Kasi baka you don't produce insulin or you don't produce glucagon or sira lang talaga yung pancreas mo. Okay, or namamaga. Okay, with regards to that, hindi ka makapag-produce ng normal na mga hormones to be produced. Okay? Endocrine disorders such as your Cushing syndrome, pheochromocytoma, acromegaly, hyperthyroidism, no, can cause diabetes. Drug and chemical inducers of beta cell dysfunction, dilatin pentamidine, okay, can reduce your beta cells production of insulin. Okay, impaired insulin action, thiazides and glucocorticoids can decrease the function of your insulin. So, hindi maganda or hindi nagagamit ng katawan mo si insulin because of these drugs, thiazides and glucocorticoids. Genetic syndromes such as your Down syndrome, Klinefelter syndrome, and leprechaunism is prone to diabetes. So, your Down syndrome and Klinefelter's disease can cause diabetes, or normally they are found. No? Diabetes is found with these genetic diseases. You also do have gestational diabetes, no? Glucose intolerance during pregnancy due to metabolic and hormonal changes because of your body, the pregnant woman does have a modification in your hormones due to because of the baby. Then this produces high glucose level in the mother. Okay? Anong effect nito? Masyadong malaki yung bata. Or, the baby will have diabetes also. Okay. Next, we go to your test. Ano ba yung mga test natin for diabetes or glucose itself? Kasi nga, di ba, glucose lang ang pwede nating i-test on your body. Okay. First, you do have fasting blood sugar. Fasting blood sugar. So, you will have nothing per orem for 8 hours. 8 hours. More than 8 hours, okay, this can be considered as over fasting. But you can consider 8 to 10 hours. 8 to 10 hours you can still use that on your fasting blood sugar, even 12, no? 8 to 12, 8 to 12 hours. Okay, nothing per orem, no? When you say orem is intake, okay, you will test the glucose in fasting state. Fasting blood sugar. Next, you do have 2 hours for prandial test. After you eat a meal, okay, after 2 hours, you will be tested for sugar test. Okay, 2 hours post-prandial. When you say prandial is eating. Okay, 2 hours. Ano pa? Test to diagnose diabetes, you do have oral glucose tolerance test or OGTT. Normally, this is administered to your pregnant woman. Okay? Dito na detect yung diabetes, gestational diabetes. No? The patient to be tested should be ingesting at least 150 grams of carbohydrate for 3 days prior to testing. So, dapat normal intake ng carbohydrates. Hindi yung, okay, magpapa-OGTT ako. Hindi muna ako kakain for 3 days ng kanin. Magugulay lang ako. No, dapat normal intake mo ng carbohydrates. Okay, para accurate yung result. Then, the patient must fast at the night before the testing to be performed. So, magkakaroon ng fasting, 8 to 12 hours. Okay, the patient is challenged, no, orally with 75. Normally, we use 75 grams glucose during the test, but we also have preparations 50, 100 grams of glucose. Depende yan sa physician kung anong ire-request. Pero normally, we encounter, no, 50 grams, 75 grams. Okay? Patient should have not eat food, drink tea, coffee, or alcohol, vigorously exercise, or smoke cigarette during the test. So, bawal yung mga yan. Kasi, this can falsely increase your glucose or decrease your glucose. Okay, venous blood samples are collected in gray top tube containing fluoride anticoagulant. Bakit fluoride? Because your fluoride doesn't, no, affect the testing even if it's in your room temperature. Okay, but non-additive non-additive tubes can also be used, and also your serum separator tube. Okay? Okay, ito yung makikita nyo. Orange, minsan orange drinks, minsan apple drink to. Basta glucose drink yan. Pag sa laboratory, minsan iniinom namin to, tinitimpla namin to. Kasi matamis talaga siya, masarap. Okay? So, yan yung 75, no? Minsan nakikita natin to sa mga pasyenteng buntis. Okay. So, ano pang ginagawa dito? Your OGTT has a, so kung kukuha ka, no? Kukuha ka ng FBS sa kanya. So, kukuha mo siya ng FBS. Paano yung procedure? Kukuha mo muna siya ng blood for FBS. Okay? Pagdating niya sa clinic or sa laboratory, okay, syempre interview, the rest and then you extract blood for FBS. Syempre, dapat 8 to 12 hours yung fasting niya. Okay, pag nakuha mo yung FBS, then have the result. Then, you will give her or him the solution after testing for FBS, or pag nakuha mo na siya ng dugo for FBS, bigay mo na yung solution. Bigay mo na yung juice. Okay? After 1 hour, you again will test him or her. Okay? After 1 hour, na nakainom na siya ng solution, ng glucose solution. Dapat yung glucose solution should be consumed 5 minutes, within 5 minutes. Okay? The glucose solution should be consumed, okay? Should be consumed within 5 minutes. Okay, dapat 5 minutes maubos niya yun. Kasi pag hindi, magiging erroneous yung result mo. And, dapat the patient should not vomit. Okay, pag nagsuka, uulitin natin yung test mula simula. So, magpa-fasting ulit siya, and so on and so forth. Okay, after 1 hour, makuhaan mo siya, dapat hindi siya nagsuka, nainom niya yung sugar solution for 5 minutes, within 5 minutes, then magbibilang ka 1 hour after that, then kukuha mo ulit siya ng dugo. Then, another 1 hour, so second hour mo, so first hour, mali yung note. Okay. First hour dapat. Okay. First hour, then second hour. So, after 1 hour, ulit, nakuha mo ulit siya ng dugo. Okay, bali 3 tusok. Pero minsan may mga doktor na 3 tusok ang nire-require. 3 hours yung OGTT. Okay. So, your gestational diabetes is diagnosed if the woman is at or exceed of the 2 following for plasma glucose level during the complete OGTT. Okay? So, if ever the fasting glucose, no, is more than 100 mg per deciliter, 105, no? Possible criteria na yan. Check na yan kung mas mataas. Kung mas mataas pa after 1 hour, so 190, check na yan. You consider this as your, so if ever your patient, no, sabi, ito yung normal values, ha? These are the normal values. Patient result mo, you do have FBS of 120 mg per deciliter. First hour mo, you do have 200 milligram per deciliter. Second R, you do have 190 or 180 sabihin natin. Third hour mo, you do have 130. Gawin natin to 170. 150. Okay. Itong dalawa, since nag-exceed na tong dalawang to, within that normal range, now you can consider your patient having a gestational BM. Okay, if ever naman, normal daw tong fasting. Normal daw yung fasting natin. So, 100 lang. Eh, yung first hour mo, 200. Yung second hour mo, 190. Still, dalawa pa rin yung kinoconsider mong mataas. So, this is still no, diagnosed with your diabetes. Gestational diabetes. Okay? Okay. You do have a another variation of this test. Okay, OGTT. You do have OGCT. Same procedure, but you will just do 1 hour of it. You will only challenge if your glucose is increased. Oral glucose challenge test or OGCT. No? First hour lang yung kukunin mo. Paano mo malalaman yan? Isa lang yung T niya. Pag OGTT, dalawa. So, either 2 to 3 hour yung kukunin mo. Okay? Palatandaan yan. Isang T, 1 hour. First hour lang. After consuming your glucose solution. Pag dalawang T, 2 hours or 3 hours. Okay? Minsan 4 pa. Pag malupit masyado yung doktor. Okay? So, you do have criteria to be used to diagnose diabetes. Okay, FBS level that is greater than or equal 126 milligram per deciliter. Or at least 7 grams millimole per liter on at least 2 occasions. So, usually, this is the borderline on your diabetes. Kasi 120 is normal. Okay? So, 7 millimoles per liter. In 2 occasions, paano? O either ngayong month ka pinagawan, next month papagawan ko ulit ng FBS. Pag ganun pa rin kataas, you will be diagnosed with DM. Okay, your 2 hours postprandial, is greater than 140. Okay? Greater than 140. Bakit? Dapat kasi within 2 hours, your body already degraded what you ate. Okay? The glucose is utilized within the 2 hours dapat. Dapat. Okay. Symptoms of hyperglycemia which include polyuria, yung 3P natin, polydipsia and polyphagia, unexplained weight loss, plus a casual RBS. Your RBS is random blood sugar. Any time of the day, you can test this. Kahit kumain ka or kakatapos mo lang uminom. Okay, any time of the day. No? Walang fasting required. RBS. Greater than or equal to 100 milligram per deciliter. Okay? Sobrang taas. Then 2-hour postprandial glucose of 200 milligram or greater than in OGTT. So, kung yung second hour mo in OGTT is greater than 200, okay, you will be already diagnosed as with diabetes. Kahit normal yung FBS mo, kahit normal yung first hour mo, pero kung yung second hour mo is 200 and above, you will be considered a diabetic. Okay? Exception to this criteria is diagnosis of gestational diabetes. Okay? Which is a condition that develops approximately for 4% of all pregnancies. So, if ever lang na yung OGTT mo is you have done this on a patient na pregnant as greater than 200, hindi daw pwede yun. Kasi exemption siya to this rule. Okay? Ano pa yung other test na ginagamit natin in your monitoring of your diabetes or checking your diabetes? You do have glycosylated hemoglobin or your HbA1c. 1C, capital C pala. HbA1c or HbA. No, 1 to ha 1. Okay. This is determined once in 3 months. Bakit in 3 months? Because your hemoglobin. Okay? Hemoglobin is the content of your RBC. And your RBC has a lifespan of 3 months or 120 days. That's why this is stable for 130 days. Usually, this is being used now, no, in diagnosis of your diabetes. Greater than 7, no, considered pre-diabetic or diabetic. Okay, this uses column chromatography, yung principle ng HbA1c or your glycosylated hemoglobin. Next is your proctosamine, no? Once in 3 weeks. This is known to be your glycosylated albumin. Okay, if you are already a diabetic, no, this test can be used to monitor your progress with regards to your medication or even in your blood sugar. Pero now, no HbA1c or glycosylated hemoglobin is a criteria for diagnosing diabetes mellitus. Okay, choice of sample. Sample should be separated from your WBCs. Thus, no, sometimes we use fluoride to deactivate your WBCs and serum separator tubes. Or after you spun it on a centrifuge, you will transfer the serum or plasma onto another tube. Okay, I forgot to note your HbA1c or your glycosylated hemoglobin, your sample for this one is EDTA. Okay? EDTA tube, yung blood. Okay, bakit? Kasi hemoglobin yung chinecheck mo. No? Hemoglobin. Okay. RBC shall have all the enzymes necessary to metabolize glucose. Thus, no, we separate them. No, in testing your FBS, OGTT, PPT, PBDS, okay, postprandial, RBS, okay. Kaya ang ginagamit natin on those are your serum separator tube or fluoride tubes or non-additive tubes, no, to separate your RBC on your um, glucose. Okay, next you have sample should be kept at a cool temperature. Okay, loss on standing or warm room may be high as 10 mg per deciliter or 0.6 millimole per liter per hour. So if ever that you will be delaying your testing, it should be kept on refrigerator or freezer to prevent loss of sugar such 10 mg per deciliter per hour. Per hour yan ha, per hour. So kung kunyari sample mo dapat talaga 200 milligram per deciliter yung patient, may DM dapat siya. Eh, na-delay yung testing. Iniwan mo lang yung tube dun sa area. Okay. It can be decreased kung 3 hours yan. So, minus 30 kasi 10 daw. So, it will have 170. No? Hindi na siya candidate agad for diabetes. Kasi, di ba, meron tayong criteria more than 200 or equal to 200 can be considered as diabetic. Okay, so be careful on that. Another, serum should be separated from the clot within 0.5 or 30 minutes to 1 hour because your RBCs can metabolize glucose. Okay, sodium chloride of 2 mg per ml of blood or iodoacetate is preferred because it inhibits glycolysis and prevents most glucose consumption by your RBC. It is good for 24 hours. No sodium fluoride. This is black top. Okay? Next is the stability of serum. More stable ang serum kaysa sa plasma. Bakit? Your RBCs are clotted. Okay? Okay, next we do have the methods of glucose determination. Ano ba tong mga principle na to? Okay. Quantitation, quantitation of your blood glucose, no? Ano tong mga to? You use Folin Wu, which uses PMA. Okay, Folin Wu uses PMA. So your PMA is phosphomolybdenic acid. Okay? Phosphomolybdenic acid, okay, is utilized in Folin-Wu method. Okay, Nelson Sumogi naman, no, uses copper. Okay, copper. Okay, accurate but labor intensive and difficult to automate. Ano pa? You do have the Bosky method, which utilizes O-toluidine method. Most sensitive method, no, uses acetic acid, no, but this is not being utilized because of your O-toluidine is carcinogenic and poisonous. Read at your 630 nanometer in a spectrophotometry. Okay, this produces green color, no, glycosamine. Next, you do have the enzymatic method, very specific to a substrate, especially glucose. Okay, ano ang first enzymatic method natin? We do have glucose oxidase method, no? Tapos first pa. First enzymatic reaction used, no, in your glucose. Okay, your glucose is binded with oxygen, which results to your gluconic acid plus peroxide. Okay, anong minimeasure natin dito? Your peroxide, which is equivalent to your glucose. Peroxide is measured through Trinder's method, okay, which you add the organic dye to color your peroxide, which produces colored reaction. And then you do have peroxidase method, which is your peroxide, no, is reduced to water and oxygen molecule. Then your oxygen molecule is measured by Clark electrode or ortho dianisylene method. Okay? This is initially colorless, but when exposed to oxygen, it becomes orange to brown color. So, yan yung enzymatic method natin. Okay, disadvantage of your glucose oxidase. This can only measure your beta glucose. Okay, your beta glucose is 65% of the glucose in your body, while your alpha glucose is 35%. So, 65% lang yung accuracy ng glucose oxidase reaction. Enzymatic method, you do have hexokinase. Okay, hexokinase. Fewer substance interference than other methods such as your glucose oxidase. Okay. General accepted method for measuring glucose. No, ano ang disadvantage niya? Hemolyzed samples can interfere because of the content of the RBC. Okay. So your hexokinase, no, glucose plus ATP will produce glucose 6-phosphate. No, plus ADP. Anong minimeasure natin sa hexokinase? Your glucose 6-phosphate. Okay? Is degraded to produce phosphogluconic acid. plus H, NADH, no? Which produces your NADH, which is colored product. Okay, color reaction. All our most of the test in glucose is a color reaction. Measure both in alpha and beta of glucose because of your mutarotase. So, mas accurate siya sa hexokinase kasaka your glucose oxidase kasi kay glucose oxidase beta lang while your hexokinase can measure alpha and beta glucose. Ano pa, you do have autoanalyzers which uses alkaline ferricyanide reagents which produces polar reaction. This utilizes ferricyanide method can give falsely high result because of several compounds in serum were oxidized by ferricyanide just as your anong na-oxidize ng ferricyanide nyo? Your hemoglobin. Okay, read at your 400 nanometer in spectrophotometry. Next enzymatic method, you do have spectrophotometric assay. Anong disadvantage? Reaction is inhibited by high concentration of uric acid, vitamin C, bilirubin, glutathione, creatinine, L-cysteine, L-dopa, dopamine, methyl-dopa, and citric acid which produces turbidity. Turbidity. Okay? Which can interfere your spectrum photometric method. Other, glucose dehydrogenase method, which uses also spectrophotometric assay. Your glucose is reduced to form a chromophore, which has a color, produces color reaction. Okay, you do have inborn errors of metabolisms like your galactosemia, congenital deficiency of one of three enzymes involved in galactose metabolism. Okay? Sabi na natin yung galactosemia. Essential fructosuria, fructokinase deficiency, so your fructose is being excreted in your urine because it is not degraded. Okay, hereditary fructose intolerance, defect in fructose 1,6 biphosphate aldolase activity. Okay, 1,6 biphosphate aldolase B. Okay, hereditary. Pero kung fructose 1,6 biphosphate deficiency lang siya, 1,6 biphosphate lang siya. Okay, wala siyang aldolase. Okay, glycogen storage diseases, deficiency in enzymes involved in the metabolism of your glycogen. Madami yan. Okay, discuss natin kung ano yan. Ayan. Okay, you do have 1A which is known to be your von Geerk, disease. Anong enzyme deficiency? Your glucose 6-phosphate. 1B, walang synonym. Okay? Glucose 6-phosphate translocase. Anong pinagkaiba niya kay 1B, 1A? Si 1B has the presence of translocase. Pompe is your 2,1,4-glucosidase. All of these enzymes is responsible for your metabolism of your glucose or glycogen to form glucose. Pompe, 1,4, 1,4-glucosidase. Your 3A is coriforbs, debrancher, which is found in your liver and muscles. Pagka-combination ng liver and muscles, you do have 3A. Pag liver lang, you do have 3B. Liver. Okay? Your 4 is Andersen, which is brancher lang. Ang problema niya in your glycogen metabolism. 5 is McArdle, muscle phosphorylase. MAC is muscle. Okay? 6 is your HERS, which is liver, phosphorylase. 7 is Tarui, which is phosphoroctokinase. 8, adenyl kinase, 9A phosphorylase kinase, 9D phosphorylase found in your liver and muscle. 10 is your cyclic AMP dependent kinase. 11 is Fanconi Beckel, no, glucose transporter 2, and 0 is your glycogen synthase because this is mainly your glycogen metabolism. Okay? Medyo kakabisaduhin lang talaga to, madami. Okay? So, yeah. That ends our lecture on your carbohydrates. If you do have any more question, you are free to message me on my messenger or even Canvas or even an email. You can send me an email. Okay, thank you.